When it comes for billing and collecting for your services, if you don't ask, unfortunately you also won't get. Patients have out-of-pocket responsibilities to pay for at least a portion of most of their visits. So it's incumbent upon you to ask them at the time of service for payment. Once the patient leaves the office, it gets more expensive and more time-consuming to try to collect those $10, $20, $30 copays. Get it at the time of service. It could be by credit card, it could be by check, it could be by cash, but make sure you ask before they leave the office for their payment. You can ask them and tell them that honestly, that your insurance company, Mr. or Miss Patient, requires that we collect this copay at the time of service. Actually, it's a true statement, and that helps patients begin to pay. I strongly recommend that you accept credit cards, whether in person, by mail, or by phone, or even online if you can. Visa and MasterCard are always the best and the most common. American Express tends to have a higher fee, so depending upon your market, it may not be necessary to accept them as a credit card company. As far as follow-up collections, if a patient hasn't paid within 30, 45 days, make sure you call them. Be polite. Assume that maybe they forgot, maybe the bill has been misplaced and they intended to pay. Sometimes, by just the very fact of calling, they'll whip out the credit card and they'll make the payment on the spot. I know I've done it sometimes, I'm sorry to admit, but you know, things get busy, it gets put aside, I think I've got more time to pay. Pretty soon I'm 45, 60 days out. Not a good place to be. When people have large balances and they haven't been able to pay, offer them a payment scheme, $50 a month, $100 a month. Be their friend. They want to pay. More often than not, they'll be happy to, but they're under pressure, they can't pay the full amount, but they can make some payment. And that's really what you want. And you'll earn someone who's going to be loyal because you treat them with respect and you can treat them with consideration. Never refer to collection without calling the patient directly. I've seen this happen and it's almost unconscionable. Sometimes all it takes is that quick phone call. Yes, it takes time. Yes, it does cost money, but you're probably going to get a much better collection and a much better relationship with the patient than you will if you automatically refer to collection and it starts a whole different set of problems.